Good afternoon, everyone. And first of all, I would like to thank the organizers of WCI to give us an opportunity to present our triple negative data at this wonderful conference. So as you know, Sahyadri Cancer Care and our department actually started very recently, about 2.5 years ago in the November of 2018. This data is from that time onwards. So from November 2018 till August 2021, almost 487 women with breast cancer presented as first registrations to the Cancer Center at Sahyadri. Of these, 131 had triple negative breast cancer, gives us 26.9%. 31 had come for a second opinion, continued treatment at their respective hospitals. 100 patients continued treatment at our center. Of these, 83 lived within Pune city and 17 lived outside city limits. The median age of our patients was 49.2 years, on the younger side as expected. 72 patients had non-metastatic disease and 28 patients had metastatic disease, and this included both de novo MBC and those who recurred after primary treatment. Both these data will be presented separately. The diagnosis of TNBC was established if patients were ER, PR, and HER2 negative on immunohistochemistry. So this is just a pie chart to show the distribution of metastatic and non-metastatic patients in our cohort of 100 patients. Let's look at the non-metastatic data first. If you look at the tumor characteristics of both the neoadjuvant and adjuvant arms, you can see that the T size was mainly a large majority had T2 tumors, almost 69%, followed by T1. Most patients had N1 disease and N0 disease, and this made up the majority of our population. Most patients had grade 3 tumors as expected, 57%, followed by grade 2, 43%. There were no grade 1 tumors. Of the 72 patients with non-metastatic disease, 20 of these received neoadjuvant therapy and 52 received adjuvant therapy after primary surgery. That makes it up to 28% neoadjuvant and 72% adjuvant. A lot of these adjuvant patients came to us after their primary surgery. We always prefer, especially in node-positive patients, a neoadjuvant approach. So 20 patients underwent neoadjuvant chemotherapy, 2 are still undergoing treatment, and 1 succumbed to COVID after 2 cycles, and she came from out of Pune and did not reach us on time. Therefore, out of the 17 evaluable, 4 patients have achieved a PAT-CR with a rate of 23.5%, and 2 patients had a Miller pain of 4/5 with a small residue in the primary tumor. Most patients had clinically T2N1 tumors, and of these, 12 were node negative after surgery. If we look at the tumor and surgery characteristics of adjuvant patients, again, you note that 67% of our patients had T2 disease. There was 1 T4 who was operated outside. Normally, we give these patients neoadjuvant therapy. And again, a large proportion of the adjuvant patients had node negative disease, followed by N1 disease. Majority of patients were operated with breast conservation approaches, 65%. 35% underwent mastectomy. SLNB was possible in 35%, and a lot of these were found to be node positive on frozen, and therefore an ALND was performed. Let's look at the details of systemic therapy, both adjuvant and neoadjuvant. As you can see, the majority of patients received dose-dense anthracycline taxane, and this is in 67%. And if you look at the 3-weekly, that was mainly because of COVID restrictions. Remember, a lot of our data has been influenced by the COVID pandemic. 10 patients received platinum in addition to anthracycline. All of these were in the neoadjuvant group. Again, all 10 who received oral capecitabine also belonged to the neoadjuvant group, and 3 patients received oral metronome therapy. Let's look at our radiotherapy data. 35 of the 72 non-metastatic patients took radiation at our center. The rest lived far away and chose to take it to centers closer to their home. Of these, 10 belong to the neoadjuvant group. Adjuvant were 25. We used the standard START-B protocol with hypofractionation, and DIBH was performed for 3 patients, all with left-sided breast cancer. The most common complications were grade 1 to skin reactions. 2% experienced a higher grade of skin reaction, and there were other normal complications that occur frequently. Lymphedema in 5% and pneumonitis in between 1 to 2% were recorded. Let's look at the patient follow-up and outcomes in this non-metastatic group of 72 patients. As you can see, the graph, the neoadjuvant seems to have done slightly worse than the adjuvant, but this is because of 1 premature death due to COVID and 1 early death in this group. But if you look at the statistics, it is really not significant. Let's look at metastatic triple-negative breast cancer now. So if we look at the patient characteristics of the metastatic TNBC group, we had 28 patients. Most of them were metastatic after adjuvant treatment. The most common sites of metastasis were lung and liver, 46 and 21% respectively. We had very few presenting with a visceral crisis, and I will be presenting the PDL1 and NGS data for BRCA a little later. Let's look at the treatment patterns. As you can clearly see, all of them went up for first-line treatment. Fewer came in for second-line treatment, and really only 11% of these made it to third line, telling you that the performance status was pretty bad. The most common regimen used was taxane, taxane platinum, gem platinum. We also used eribulin. 3 patients had PARP inhibitors, and 4 patients had access to immunotherapy. These are the follow-up and outcomes of our metastatic group. Again, it appears that the de novo group fared better than those after primary treatment, 3 versus 9 deaths. But really, again, this is not significant, and the numbers are very, very small. This is the overall survival for our 100 patients, which is estimated at about 4 years. But like I said, it's a short follow-up of 34 months, and it's really difficult to comment on this graph. Let's look finally at the HPOC panel testing. We were able to convince all our patients underwent genetic counseling, but out of the 100, only 30 patients went in for genetic testing. 13 were metastatic, 17 non-metastatic. The median age in this group was younger, 40.5 years. Remember, the median age of our entire group is 49. If you look, we had a positivity rate of, again, 30%. That is, 9 patients had pathogenic BRCA mutations. 8 of these were in BRCA1. 1 of these was in BRCA2, as expected with triple-negative breast cancer, and 4 had a variant of unknown significance. So this is my last slide. This is the metastatic PDL1 status. We've started doing it regularly in patients. So 20 patients out of the 28 were tested for PDL1 by SP142 Ventana platform. Of these, 7 were positive, that is more than or equal to 1%. That leads to 35%, 65% negative, and only 4 patients had access to immunotherapy. 1 patient had a partial response, continues to be well 15 months post-treatment. 2 patients had progressive disease, and 1 is still undergoing treatment. So with that, I conclude our data of TNBC from the Sahyadri group. Thank you once again for the opportunity.